Well, thank you. And Chairwoman Eshie, I want to thank you very much for organizing this hearing here today on the maternal health crisis in America. It's good to see so much engagement by the committee this morning on our first committee meeting back after the district work period. First off, I want to say I'm really proud to be a co-sponsor of Representative Kelly's Mama's Act, and I'm so glad that she joined the committee this year. She is a champion on this issue, and her voice is vital to this discussion, and it is needed. It is just horrendous what is happening with disparities when it comes to maternal health in the United States of America. And I want to thank the witnesses for being here. And for providing your expertise. Already I've seen members making long lists of how we can improve the bills that are before us today. Ms. Irving, thank you very much for sharing the story of your daughter. You're very brave to do so, and I know she would be very proud to know that you are carrying on her work. I'm also grateful to the advocates across America who engage every single day, whether it's the March of Dimes or it's the American College of Obstetricians and Gynecologists or Every Mother Counts, the folks in the trenches, making sure that whether they might be Healthy Start, making sure that women and families have every opportunity to have healthy children. In the Tampa Bay area, I am very fortunate. We have a terrific Healthy Start Reach Up initiative led by Lo Berry. They're one of the national leaders. But what they tell me is while they have years of experience and they're making progress, they're not able to reach everyone. That we're still not able, after so many years, to ensure that women of childbearing age get the services, get the support that they need. I mean, in America, it's so disjointed. Medicaid and maybe private health insurance, and maybe you're uninsured and you're trying to find a community health center, but that community health center doesn't provide care. It's still not enough. And I was really taken by the comments of Dr. Ruiz and Representative Butterfield, who highlighted this really is a continuum of care that is in crisis. And add on top of it the disparities, the racism that continues, the social stigma probably in many different groups. We've got to do so much more. So I'll look forward to, as we get into the markups on these bills, how we can really tackle this continuum of care. I'm also fortunate back in Tampa, we're home to the University of South Florida. Dr. Judette Lewis is the chair of the College of Medicine's Obstetrics and Gynecology Department. She shared, again, the sobering statistics. In Florida, Black women are nearly 3 times more likely to die from pregnancy-related causes than white women. She said that, yes, the maternal mortality review committees and the perinatal quality collaboratives are helping, but so much more needs to be done. I want to start my questions with Ms. Irving. You've listened. These folks are very smart. Members of Congress has some insightful questions. What would your daughter want to highlight after listening to everyone here today? What would your daughter say? Boy, that's absolutely right. What would she have wanted to highlight to this committee?
I wish I knew. My daughter was a brilliant person. I think what she might say or start off saying is, this is not a new phenomenon. This has been going on for decades. Why can't we get it right? There are things that can be done, but are not being done. I think she would probably say that behind every one of these statistics, there's a woman who's loved, who's missed, and look at the domino effect. Look at the families, look at the children that are suffering because we can't get it right. She would want us to look at making sure that there are the standard care policies and procedures in place, and there is some accountability behind it so that we can make sure that folks are being listened to. I listened to all of your talk and things about people come in and it's the hospitals, and there's certain hospitals where you can't go or where you won't get the same amount of care. That wasn't the case for Shalon. The case was that she wasn't heard. She came in, she presented with the symptoms. It wasn't that she was making it up. She came in with swollen legs. She wasn't voiding. She was gaining weight. She gained 7 pounds in 1 week. And she was there 3 times that week. Her blood pressure was off the chart. She was not only not listened to, she wasn't, her symptoms were not addressed. She was there. She was in a very, very good hospital. She had great doctors in that hospital. She had gold-plated insurance. She was not an ignorant woman. She knew what was wrong, and she kept saying it. I don't feel well. This is not me. There's something going on here. But she was dismissed with the, oh, it's fine. You just had a baby. Give it time. Don't worry about it. I think my daughter was just so tired at that point. She didn't stand up and say, look, I am going to the emergency room, or I'm going to call another doctor, or I'm going to another hospital, or whatever, until somebody listens to me. With a newborn baby, with colic, with respiratory distress, she just was tired. And she needed someone to advocate for her. She needed someone to realize that they had to take care of her at that time. And so I think she would just be off the chart right now, because that's not happening.
Well, let that be a lesson for all of us as we move these bills. Thank you.